It's really important to understand that by leaps and bounds, since 10 years ago, progress has been made in understanding individual women's risk of developing breast and ovarian cancer. But we don't have all the answers yet. What's critical to know now is that if you find that you are at increased risk, there are things that you can do. There are screening and prevention programs around the country now that can help you. If you live in a place where there is no screening and prevention program, seek out a doctor who is interested in this in your area, and they will help you understand what you can do. We now know that it's important to evaluate the risk because there are, especially with things like the BRCA mutation, but possibly women who have no BRCA mutation may have an equivalent risk. We can determine that individual populations of women can have risk up to 87% of developing breast cancer over the course of their lifetime or up to the age of 70, and a very high percent, 40% or so, of developing ovarian cancer, which is a rare cancer in our society compared to breast cancer. And then you can, with proper guidance, you can do things to minimize your risk. We have options now. There is prophylactic surgery. Women can remove their ovaries and their tubes at a certain point, but the balance of when to do that has to be assessed for each woman. Women can remove their breasts. Again, there are pluses and minuses, and it's a complicated decision. It has to be done with the help of someone who is aware of all the complications, the benefits, and the risks. And this kind of prophylactic surgery is an option for those at very high risk. In addition, we have chemoprevention, chemo meaning drug, simply drug, not chemotherapy as we think of it applying to treatment of cancer, but drug prevention, and in particular tamoxifen has been widely used. What I would say to women is that this field is changing rapidly, that there are many options now in terms of alternatives to lower one's risk, that what you need to do is look into a program near you. We at NYU have a program where we have developed research trials. Many other institutions have done this as well. And there are people who are absolutely appropriate for research trials looking at ways to either earlier detect cancer or to prevent it altogether or reduce the impact of the cancer that forms.